Very much, Madam Chair and other honourable senators, for the opportunity to speak on medical cannabis for veterans and first responders. I am Alex Kroon, President of Canada House Clinics, which was until recently known as Marijuana for Trauma. We were founded in 2013 by veterans who discovered that medical cannabis transformed their lives after years of struggling with conventional pharmaceutical treatment of combat PTSD. Medical cannabis has been legal for 17 years. Humans have used it for thousands of years. Compared to many drugs, it is safe, has not been fatal in overdose, and at minimum helps people sleep better, manage mood, and cope with inflammation. Side effects can be managed, and it has a lower rate of addiction with smaller withdrawal effects. It is an exit medicine, not a gateway drug. We cannot ignore what our veterans and their spouses and partners tell us. When a crying wife drops off her husband at our clinic pleading after 2 years of conventional treatment that she can't help anymore and worries about his suicidal ideation, we know traditional therapies fail many veterans. We believe in our motto, we help renew lives, because every day we see powerful positive changes. Beyond reducing nightmares, insomnia, pain, depression, anxiety, and reliance on alcohol and opioids, a high percentage of our veteran clients report that medical cannabis improves their lives through mood regulation to have more compassion for those they love and care for. Veterans on traditional medications describe feeling like zombies, isolated in their basements, still clinging to unhealthy thoughts, impaired by hypervigilance, and not able to sustain normal relations with spouses, children, and friends. Only vaporization of cannabis provides the fast, 5-minute response to onset of triggers that give veterans confidence to return into society. Cannabis creates the conditions to have energy and self-reflection to work on therapy. When we sample our data, the vast majority of clients reduce use of pharmaceuticals, including use of opioids. At Canada House, we treat everyone, including seniors. Seniors share the same negative polypharmacy, where one person is prescribed over 5, if not over 10 drugs. There is significant clinical evidence that polypharmacy is harmful, and the original clinical studies that approved those drugs did not test the impact of polypharmacy on vulnerable patients. Seniors tell us of many years struggling with standard treatments and then gaining significantly better quality of life with medical cannabis. That is why 94% of our staff, when we survey them, reported that their job is very meaningful. We want to thank veterans, first responders for their sacrifice, Veterans Affairs, researchers, and all doctors who are open to exploring cannabinoid therapy. And we welcome your questions today. Thank you.
How do you think the legalization of recreational marijuana will affect veterans' use of medical marijuana? Do you anticipate that people could self-medicate using recreational cannabis without appropriate medical follow-up?
We hope and certainly will encourage all veterans to continue to go through a medical process relative to their cannabis use for PTSD or chronic pain and other conditions. As you've indicated, it's extremely important to fine-tune the treatment. Again, it's never simply just about one strain of cannabis. There's different uses during the day and the evening. There is some experimentation that needs to occur. And therefore, in terms of having ongoing clinical assessments, ongoing renewals, it is very important that it continues to go through a separate medical process.
I just have 2 friends in hospice who use medical marijuana on a daily basis, and I understand how it helps people. But it's not a cure-all. How much research goes into finding the strains that actually work for the greatest number of people, or is it a chance that you're taking?
Well, I mean, it's an excellent point. We feel strongly about this. If anything, there probably should be more regulation relative to the clinic side of the industry to, again, have the, that you've only got well-trained, experienced kind of medical people who are recommending particular strains. And so in our case, we have 10 clinics across Canada. We've got years of experience, and so we share information amongst those educators that indicates what has worked for different conditions for different patients. The most important element is that we have this database in terms of tracking, what pharmaceuticals people were taking, how those pharmaceuticals change over time. And now that we are quite close to being able to have an electronic interface with licensed producers to get their certificate of analysis, which shows exactly, because when people talk about a strain, it's a bit of a misnomer, because the same strain for 2 different licensed producers could have a different profile in terms of the active ingredients. And so ultimately, we believe we have to have the actual cannabinoid profile of what people are taking, marry that with ongoing data, patient data and experience, and then we will have a database that over time we can work with researchers and scientists to indicate from a real life experience perspective. And certainly ourselves as Canada House, we want to take that leadership position in terms of ensuring that we get as much data as possible. But 100%, people have to go through qualified cannabinoid educators, medical folks, in order to kind of get onto the right prescription. Because if they don't, then you definitely run a risk of not getting the right results.
How diverse is it? I mean, is every plant different? I mean, does every plant give it?
Strains and thousands of cannabinoid profiles. Absolutely, and that's why it's such a difficult thing to study. And we're very lucky here in Canada because we're the first country in the world to create a regulated market where the products coming out of licensed producers are lab tested. There's a certificate analysis that goes with that product. And until we can connect that certificate of analysis to the medical history and the treatment protocol, we won't be able to crack this code. And because it's not a single molecule pharmaceutical, you can't be studying it in conventional phase 3 clinical studies. Right. Essentially, you do phase 3 clinical studies to get to the phase 4 studies, which is real world tests. Now, this has been brought to market through Supreme Court rulings, so we don't have the need for phase 3 clinical studies. And because it's a multi-molecule substance, we need to study it and approach it differently. And that's what we've invested almost $2 million in developing, is this software platform that manages our clinics and our clients' experience, at the same time collects this data and allows us to see trends between cannabinoid profiles, treatment protocols, and particular conditions. And to answer your earlier question, I would never argue that cannabis is a cure for PTSD or other conditions. It's no different than any other pharmaceuticals. Sure. What makes it different is it's better at treating multiple conditions, and it creates the appropriate mindset for veterans to heal, to reintegrate themselves, repurpose themselves. And I think that cannabis is a much more effective treatment of PTSD and a tool for transitioning out of the military than handfuls of pharmaceuticals. And when guys are in zombie-like states, they're not being self-reflective, they're not understanding what triggers them, and they're not able to improve their lifestyles.
Mr. Kroon, in your presentation, you mentioned that veterans on traditional medications are not able to sustain normal relations with spouses, children, and friends. So my question is this: in your experience, does the use of medical cannabis by veterans increase or decrease the ability to function on a daily basis with family and friends?
Our veterans overwhelmingly indicate that has a significant impact in terms of their ability to have useful and productive relationships. Again, to have compassion for their spouse, their children. There are examples where our clinicians in a particular clinic would first meet a veteran coming in, who might not sustain eye contact, is really not participating in conversation, clearly seems quite withdrawn, is quite stressed. You can tell that they are in distress. And then, 3 months later on that renewal, they're coming in, they're engaged, they're happy, they're hugging folks kind of within the clinic. And so many veterans will, and certainly spouses as well of their partners, will describe a significant change. And again, we're not saying that it is the cure. It creates the circumstances in which people can do the self-reflection. And so, when you think about cognitive behavior therapy, talk therapy, other elements, you have to be in a place where you can process that information. If you're not sleeping, if you have nightmares, if everything, people might trigger on a number of different things. And, if you can't be able to kind of process and think about what you need to do to kind of move your life forward, it's not going to be effective, right? And so it creates the conditions in which people can do the work that's required in order to transition. And, as I understand, Riley is a veteran, I'm not, that even without PTSD, it can be a difficult transition from military life, if that's all you've known for many years, into civilian life. It's a completely different world. And that creates a certain amount of stress, without even PTSD being involved. And so when you throw the two together, it's really asking a lot. And, it's challenging for folks who are diagnosed with PTSD while they're still serving. And quite honestly, it's a long and difficult process. and it's probably even worse, before they actually fully leave the armed services and are then outside. So, yeah, absolutely, the overwhelming evidence in terms of the veterans that we work with is that it has a very positive impact.
On behalf of the Subcommittee on Veterans Affairs, first, Mr. McGee, let me thank you for your service on behalf of all Canadians. And I want to thank you both for your presentations. This has been for us a very interesting hour almost, and we're deeply appreciative for your presence here, so thank you. The committee will adjourn.